Yeah, it's been a ride. I guess I had to go to that place to get to this one.
So on Tuesday, I was at Southampton Healthcare. That's where I go to the doctor, Dr. William Summers. And for my 8-week checkup, since I started the AAA, I am in a drug trial. And as most of you know, on June 6, 2011, I was diagnosed with HIV. But I've been doing very well, thanks to the medical staff, the complete staff over at Southampton, and Michael and Sherry, and I know I'm forgetting people, but they just treat each patient so well. And so while I was there, I picked up a copy of Pause. This is a magazine, Healthy Life and HIV, and you can get it at Food Outreach, Walgreens, your HIV practitioner, or you can go online to pause.com, that's POZ.com. And the interesting thing was in the September issue, page 43, there is an article that caught my attention, and the title of it is Facing the Future of HIV Care. And in it, it talks about that Ryan White, it's the legislation that allows for funding of programs that assist HIV and AIDS patients. And this legislation is up for reauthorization in 2013. And there's a lot of debate on whether this is going to be continued, whether they're going to lower the threshold for patients for Medicaid. It's really up in the air, and you'd have to read the article to get all of the nuances of it. But I'm going to highlight a few of the things. ADAP, which is the program that allows for drugs. At the time this article was published, there was more than 8,500 people who were on the wait list for the drug coverage program, which is called ADAP. Ryan White, it has 4 funding divisions, and currently Republicans are pushing for further cuts that would slash the budget by billions, according to the AIDS Institute. That's not my opinion, that's what the AIDS Institute says. Like I said, Ryan White comes up for reauthorization in 2013. And there's a quote in here. It says, Ryan White should be what it was originally intended to be, filling in the gaps and access to care and essentially the essential support services. So, I guess if there's one thing that I want to challenge you as my viewer to do, and they're definitely doing this in the article, it says to, do your bit, fight for Ryan White. Concerned about the potential loss of Ryan White money to provide crucial services, worried about the threats to Medicaid. You should, everyone really should, but especially people living with HIV, should call or write their member of the House of Representatives and their senators and say, I benefit from these services. I know I've heard advocates here in Baltimore speak very movingly about how I don't think I would be alive today if it weren't for the Ryan White programs and the services I've gotten that were funded through it. And you can find out how to call and write your representative or senator at contactingthecongress.org. That's contactingthecongress.org. If we do not fight for this funding, if we do not fight for these programs, they will go away. If they go away, that's not good. This bottle of medication, depending on what the medication is, they can range between $3,000 to $5,000 a month. Yes, there are programs out there. Locally, we have EFA, we have Project ARC, we have various programs. Nationally, there are programs. But all of these programs pull their money from grants and from grant monies that come through the Ryan White. So if this funding gets cut, that just means a very hard time for HIV patients, for AIDS patients, to maintain. Without these medications, it is very hard to maintain a healthy life and that longevity that we strive for, because you have to take the medicine every day, same time, just as the doctor orders. So I would encourage you today, even if you're not positive, even if you don't have HIV, if you have a friend, if you have a loved one who has been affected by HIV, contact your congressman, contact your representative, contact your senator, and let them know you do not want this cut. If you have HIV, you have a vested interest in fighting for this funding. Till my next video, remember, do something positive.